honorable members of the Parliament of Great Britain, my fellow citizens, health professionals, ladies and gentlemen. I am Dr. Mohammed Adil. I'm fellow of the Royal College of Surgeons of UK with 30 years of unblemished medical record while working as a surgeon for the NHS. It was a great honor and privilege for me to be part of the debate between the public and the Parliament regarding the COVID-19 and its related injuries to the members of the public on 24th of October in the Parliament House, and prior to that in the House of Commons on 20th of October 2022. I am most grateful to Sir Christopher Chops and Sir Desmond Swayne, Mr. Bridgen, and dozens of the honorable members of the Parliament for their precious time and devotion in order to arrange such a magnificent and useful meeting to discuss with the public regarding their injuries sustained as a result of COVID-19 vaccination. Being a humble citizen of the Great Britain, I am very proud of Britain's values of democracy and human rights, equality and justice, freedom of speech and expression, freedom of holding an opinion, freedom of press and publication, freedom of assembly and protest, freedom of security at work, equality and justice, regardless of any trust, any belief, any color, race, religion, or individuality. Today, I would like to discuss the health issues sustained as a result of vaccination injuries to the members of the public, which has been quite serious. I appreciate the sincere efforts of the previous government and the health agencies to curb the spread of the coronavirus with extraordinary restrictions and lockdown to save the public, and the rollout of unlicensed and experimental vaccine in rush without going through proper trials and safety measures, which usually requires at least 10 years. 2 years down the line, we have come to the point when people have lost their jobs, income, their livelihood, they lost their freedom, and have sustained mental and physical health due to lack of health facilities. And thousands of people have sustained injuries as a result of COVID-19 vaccination, which requires urgent attention by the honorable government at this stage. Honestly speaking, there has not been any robust scientific debate between the health authorities, government, health professionals, clinicians, and the scientists to make a strategy in order to control the COVID-19 and its spread, and the unprecedented rollout of vaccination, which has resulted in severe injuries to the public. People were forced to have a vaccination because of winning their liberty, freedom, returning to their jobs, traveling in and out of the country, and for earning their livings without having been told about the possible risks and complications involved as a result of vaccination. This new mRNA vaccine has been extremely new for all the scientists and the health professionals because of the spike protein and cytokine storm and hyperimmune system of the body, resulting in cardiovascular damage, thrombosis, lung damage, strokes, Guillain-Barré syndrome, paraplegia, kidney and liver injuries, especially in the extreme age of life, in the youngsters and the elderly patients. I have seen larger patients who had sustained injuries and had damage and disabilities and are wheelchair bound. I feel sorry for those who have lost their lives as a result of sudden heart attack because of the vaccination. And at this stage, it's highly recommended to the honorable government to make compensation for those who have sustained irreversible injuries and damage to their health, and those who have lost their livelihood and jobs, and they're not able to sustain because of the financial hardship and loss of livelihood. Secondly, I would like to emphasize at this stage that there are more than 10 million of patients waiting for the investigations and treatment for the last few years, especially the cancer patients. 140,000 health professionals are short, as per NHS figures. Thousands of nurses, paramedics, and social carers are absent. They need to be brought out to run the health system within the NHS. Thirdly, hundreds of doctors were warned, dismissed, suspended, and conditioned by the regulators because of their freedom of expression and speech on the COVID narrative. All the health professionals should be reinstated unconditionally to return to their work to help out the NHS for clearing the waiting list and to helping out their patients. And lastly, I would request to the honorable government to look into the Medical Act 1983, which is long due for robust changes, as regulator is exploiting this law to crucify highly qualified and experienced doctors within the UK, which are detrimental to the safety of the patients and the profession and the member of the public because of loss of their morals and incentives. With these requests, I would like to extend my deepest gratitude for your precious time and consideration for looking into this matter at your earliest convenience. Many thanks. Bye for now.